starting about thinking about climate change. Where do we start? Where do we start as OTs, and where do we start within our organisation? So, and we know that staff are overwhelmingly in favour of delivering more sustainable healthcare. So I think it's 76% of the NHS and 75% of the Royal College of OT survey.
Off.
No, you haven't. No, you haven't got your camera off.
No, I'm trying to turn it off.
Don't worry. If you don't mind, that's fine.
That's
Yep,
okay.
there it is.
Okay,
great. So I thought I'll just do 6 quick things, maybe ways of thinking about it, because people know that they want to do something, but they don't really know what to do. And I've done this slightly tricksy SUSQI with the things about thinking about what is our superpower, what can we do, understanding, learning and reading, and thinking about how to start a project and finding our allies, quick wins, and then inspiration. So yeah, so that's why I've put the SUSQI. And SUSQI is the Sustainable Quality Improvement, which is a kind of basis of all different changes within sustainability. Okay, next slide. Can I get on to the next slide? Okay, has that changed for everybody? If you just shout out if it hasn't. Okay, so you have to think about, this is a really brilliant, Dr. Ayana Elizabeth Johnson. She did this TED talk, and I really urge people to go and have a look at it if you haven't already, because she's wonderful. She's a sustainability champion in the world. I think she does a lot of stuff on the deep sea, and she says that you have to be really clear about what we're good at, and what needs to be done, and joy as well. So she put this Venn diagram together so we can start to think what work needs doing. And we know that so much needs to be done. We need to have changes at system levels. We need to changes in terms of climate justice, in terms of nature, politics, food, healthcare, transport, buildings, education. Everything needs to change, and we know that, but we don't know, so that can be a bit overwhelming. But we know the work that has to be done, but then we also know what we might be good at. So obviously I would probably be really terrible on thinking about changing systems in buildings, because I don't understand about that. But we can think about, as OTs, what can we do? What are our skills and our resources and our areas of expertise? But the most important thing is really think about what brings you joy. What can you carry on doing? Because we're going to be in this for the long haul. We know that people get burnt out. It can be really dispiriting, and you can sometimes feel like you're the only person doing it. So it's very important to feel that you have something that brings you joy. I had a friend who was saying, I think I should be thinking about insulation because it's really important, but actually she wasn't interested in insulation. She's interested in nature, and now she's going out and clearing rivers and seeing otters and having a most fantastic time, and it's really bringing her joy. So I think it's really important that we think about ourselves and looking after ourselves as well. And so thinking about occupational therapy, in terms of our clinical practice, sustainable clinical practice is not all about recycling. And people quite often, when they think about sustainability, think about recycling. But it's for us as clinicians, it's about prevention. First and foremost about prevention, secondly about empowering patients, and I think as OTs we're really good at that, managing their own healthcare. It's not just saying you do it yourself, it's thinking about healthier lifestyles. How we get people linked in with local walking groups, or to helping their mental well-being, thinking about the litter pick that Annie's going to be talking about. And then thinking about lean service delivery, streamlining care services, so making sure that we don't have waste. We don't have waste in terms of people talk to each other, so that there's only one point of contact, or that when people come to a hospital appointment, they don't come to one appointment and then have to come back 3 days later for a different one. Can we make those more sustainable? Can we think about ways of making it just better care, really? Because we'd all prefer that when we're receiving the care, that it's better care. And then low carbon alternatives. And we're very good, again, as OTs, at thinking about lower carbon alternatives, thinking about not really high intensive carbon healthcare like surgery and medicines, but we're thinking about how do we provide care in a better way. So that's the kind of basis. And then when we're thinking about the understanding, so we go from the superpower as OTs, what our superpowers are, to what the understanding and learning is. There's lots and lots of information out there. There's staff training that's free and online, from the NHS, from Greener NHS, from The Royal College of OT has also got a sustainability page. If you're part of the Royal College of OT, they've got 10 priorities there, looking at where we'll look in terms of lots of different areas of OT. There's the Canadian Sustainable Occupational Therapy Playbook by Janet Craik, which is free and online as well. But it's under Cascades in Canada, and that's got different areas of OT, from procurement and equipment to thinking about different types of therapy. And then there's the Centre for Sustainable Healthcare, which is, again, lots of information, lots of case studies. If you think you're looking at something and you wonder if somebody's done it before, it's a really good place to look for case studies. Also, Green at NHS has got lots of case studies. And then thinking about what happens in your trust and your green plan. So how can you contribute to the green plan? It's being redone at the moment, 2025. And joining the Green Champions. Great to hear that people are here because they're becoming Green Champions, and they can find out what's happening locally in your trust and in your area, and how can you be part of that. And make sure you talk to other people about it. And then if you have a project, so you're starting a project, thinking about who are your allies, and that's not just within OT or within other therapies, but thinking about how do you link in with the sustainability department or the sustainability lead. How do you think about estates and facilities, because they may well be the people that you need to think of. Quite often infection control are people you need to think of if you're trying to look at reusable rather than single-use items. You need to link in with infection control and make sure that and IT and communications, again, is a really big one. Thinking about how do we communicate what we're doing, how do we talk to patients, how do we talk to the public, how do we talk to our colleagues about what's happening, so that everybody knows what's happening in the best possible way. Then start a working group, thinking about the monitoring, evaluation, risk assessments, all the things that might be part of whatever you're trying to change. And often it's easier to start a small thing, a small pilot, and then scale it up, rather than think, right, we're going to rid the hospital entirely of gloves. How do we start it small and then build it up? And if once you can prove that it's worked in a small area, then it's much easier to go with the facts and figures and say to people, look, we've saved this much money or this much waste or with this much carbon, and we've made things better for these people, and we've got good feedback from patients and from the public is a really big one as well. And then what platforms and providers can support you. So there's lots of things you need to think about. And then, oh dear, I seem to be jumping ahead. So then thinking about quick wins, if you can think about where are the quick wins, find your allies. Like I said, there will be allies out there. Don't feel like you're on your own. And then thinking about things like, can we make sustainability an agenda in every meeting that we have, so that when we have team meetings, sustainability is part of the agenda, the same way that safeguarding might be, or that how annual leave might be, or things that are part of your standard agenda items. Can you have something in your team away day where you're talking about sustainability? Can you have it part of people's personal development review or their annual review, so that you get some time to manage to do the projects, because it's very difficult to fit in the extra time when you're busy clinicians. Can you get students to do projects or case studies or literature reviews, or can you make that part of your, like I say, you make it part of your development review, to think, right, I really want to do a literature review on this, or I want to do a project related to sustainability that's this, and then you can give it some of the time that it deserves. Other ways of things are like changing one thing a month, or having newsletters with good news, so that find out, there probably are newsletters around in the trust, but can you contribute to either your trust newsletter or to your local department to say, these are ways to save. Find out what matters to people, talk to them about it, and listen to what matters to people. Quite often people say, oh, it's expensive to be sustainable, but actually you can think about lots of ways that it's actually cheaper. So ways that you can save money and turning things off, washing less, eating less, or eating differently, or freezing things. There's lots of different ways of saving money that's also more sustainable, and reusing things, and think about what changes you can make easily in the department. So small, easy changes, like, can people bring in their own mugs, or have a meat-free Monday, or make it something that everybody can be involved in without imposing it on people. So there are quick wins as well. And then finally, I just quickly wanted to talk about when we're talking about students and getting them involved, the planetary health report card. So Catherine Potter who's here on the call she's expanded this, so it's an international report card that's student led worldwide to evaluate their training programs. It started with medical students, and it's now Catherine has adapted this for OTs. And we're starting it in this country as well. So she did it for her university while she was developing it, and we're now expanding it to other universities as well, so that students will look at how their curriculum, their organisation is green. And the idea is that then you can build on that year on year. And then finally, just inspiration. I feel I was very inspired to read this. This is Nick Watts, who was the Chief Sustainability Officer last year. And he said clinicians have been slow to this fight to sustainability, but once they show up, they can move mountains. And I feel really inspired by this to kind of think, yes, we can. We do amazing things, and we can move mountains. So I really would just hope that people don't feel dispirited and they feel like they can do something. And we don't need anybody to be perfect. We just need everybody doing a little bit to make it work. And there was 1.4 million people in the health service, and there's 36,000 OTs. I think we can make a difference if we just do a little bit each. So I will stop sharing now and hand over to somebody who has done the work, and that's Annie. So I can pass over to Annie now. Thank you.
Thanks, Jackie. That was really good and actually resonated really well with a lot of the stuff I'm doing. So always feels good. Let me see if I can share my screen. Is that showing all right for you guys?
Yep. Yes, that's great.
So I'm going to talk to you today about a litter picking project that we've set up in the mental health service I work in. So I obviously did a bit of a brief introduction about me, but just I'll go over again because I know a couple of people have joined. So I'm an OT within Swansea Bay Health Board, and I've been there for over 10 years now. I'm originally from Newbury, Berkshire, but have been Welsh ways for about over 20 years, a long time. And I work predominantly within adult mental health services. I currently lead 5 different services within secure service and recovery. So I cover lock rehabilitation and their step-down houses, the adult community forensic team, 24-hour supported living placement, and I also oversee a vocational OT role as well. I'm a big advocate for green and blue spaces for wellbeing. I've got a young family myself, clean, cold water, wild swimmer, beach cleaner. My kids will tell you that every time I'm at the beach, I make them do a beach clean. And I've been involved in a few of the local sort of Sofas Against Sewage campaigns. And then about last January, I think it was, I completed the Introduction to Sustainable Healthcare course by the Centre for Sustainable Healthcare. And from that, I was like, oh, I really need to do something. I spoke to my supervisor about what I'd done in it, and she was like, oh, I don't really think I know what sustainability is actually. And at that point, I was like, right, if she doesn't know, there's probably a lot of people who don't know. So I ended up presenting to my sustainability, the leads in the health board about sustainability. And from that, I've taken on as a bit of a sideline being the sustainability lead within our health board for OT. So the background to the litter picking project we've done. So we've got an OT team based on one of the wards I work on, which is an 18-bed high relational support locked rehab unit, and it has associated step-down houses that go with, which are on the same site as well, and they provide care for men with severe and enduring mental health conditions. Due to them being on a locked ward, they have really limited amount of leave time, some of them off the ward. Therefore, when they are off the ward, we're really keen to promote that time being in green spaces for their therapeutic activities. So we're looking for a group which would have positive outcomes in terms of like their mental health and well-being, as well as having a positive environmental impact. And alongside that, it was something that we're always keen that whatever activities we do with the men, it's something that as they move through their recovery journey, they can continue to do it on discharge. In Wales, we have some quite specific legislation around sustainability and environment. We've got an earlier net zero target in Wales of 2030 for public services to kind of get on board. We also have what's called the Wellbeing of Future Generations Act, which is a great bit of legislature, if you're not familiar with it, which requires public bodies to improve economic, social, environmental and cultural wellbeing by engaging in sustainable development. And the Environment Act Wales also talks a lot about sustainability. So the aims of the group we were looking at, as I talked about, is to improve patient wellbeing, taking them out into green spaces and allowing them to give back to their community. So by getting active in a sustainable way, which fits in with the 5 ways to wellbeing. We were quite keen to educate parents about the importance of caring for our environment and making it healthier for both wildlife and people. Other aims included improving their physical fitness and promoting a healthier lifestyle, and other goals which could also fall into it, things like developing their social skills, increasing their motivation, increasing their confidence in the community, as well as developing roles and routines and potentially engaging in volunteering long term. So Mal, whose quote is at the bottom, he was really instrumental in setting up this group. He was really keen to do something in the natural environment, which also had the opportunity for them to give back to the community as well. So in terms of what we did, we set up a weekly litter picking group, which was run by the OT staff on Gwelfor. In Swansea, we're really lucky. We've got what's called the Environment Centre, which I think it's been there for about 30 years. It's a local charity. And as part of the different services they run a fortnightly litter pick in the marina. As part of across Wales, there's Keep Wales Tidy litter picking hubs all across Wales, and the Environment Centre is one of them. So we collaborated with them, and our patients will go down every other week to them, and then on our alternate weeks, the OT team runs a group again with the patients, and we'll take them to green spaces all over Swansea. It might be with the local parks, one of the local beaches, and we'll carry out a litter pick there. We have a maximum of 6 participants that we take per session, and it's a closed group because we like participants to commit to attending to a series of sessions. So the ward has, for this group, we have a 3-to-1 patient staff ratio, which is what slightly limits the number of participants that we have per session. So there are barriers to the group within our service. We have restrictions with the patient group. Most of the patients are under the Mental Health Act section patients. Some of them also have Ministry of Justice restrictions, and they can include exclusion areas in Swansea that they're not allowed to go to, as well as if they got a set amount of leave and we want it to be increased, we have to request that through the Ministry of Justice, which can be quite a lengthy process. Patients may lose their leave due to breaching ward rules. So things like if they've absconded or they've used illicit substances, it can be quite unpredictable sometimes when running the group, knowing you might do like a weekly plan or a week in advance, but actually come that week we might find that certain people aren't allowed to go because of their leave restrictions. The Environment Centre is set in the centre of Swansea, so transport's always needed. As I expect the same as England, we're always short-staffed, particularly in the nursing staff. And if we want the 6-to-1, it's normally OT and nursing staff that go along to the group. So staff numbers can be an issue sometimes in terms of managing the group. Wales is not always known for the best weather, especially this time of year. We have a lot of wind and rain, which can put participants off. So it's important that they've got appropriate clothing and things. Lack of motivation can be an issue sometimes, particularly if people are suffering relapses in their mental health. And the group runs in the morning, which is, I think it's 10 o'clock it starts. So that can put certain patients off because it's earlier in the day, particularly depending on what medication they're on, and for harder to engage patients who tend not to get out of bed earlier in the day. We also have certain patients who have physical conditions as well, comorbid conditions such as diabetes, COPD. A lot of them are quite overweight and have low fitness levels, so that can impact on sort of the distances they can walk and the terrain we look at. And also we have to consider the group dynamics as well. Some of these issues can be overcome in terms of, we do sometimes run the groups on the ground. So actually that picture on the slide there is set part of our grounds. We're really lucky where the hospital's based. It's got beautiful grounds and meadows. So there is space straight off the ward into lovely green spaces, but sometimes it's nice for the patients obviously to get further afield. And but yeah, there is that option there. So all our groups as well, we do thorough risk assessments, and it's agreed by the MDT prior to anyone joining the group. So on to sort of benefits and outcomes of the group. So there's significant evidence that spending time in green spaces improves mental health. And this is both for the patient group and the accompanying staff. I sit on the Wellbeing Forum for our health board, and I'm always really keen to promote staff spending time in green spaces. I think it's really important. So actually, the staff who go out on this group, I always think they do get that added bonus. It helps instill positive changes in our patient group in terms of longer term habits. Then people with mental health issues can often be quite marginalised in society. So by collaborating with the Environment Centre, it gets them the opportunity to link with the wider community and help form their new relationships. Also gives them the opportunity to develop their social skills and create positive connections with the wider community. Again, as I mentioned previously, it provides meaningful occupation and increases structure and routine to their weeks. The hope is that they will then sustain longer term environmental action. So as on discharge, they could continue attending the Environment Centre group, or there's potential that they could carry out independent litter picks post discharge. There's evidence as well that even a quick litter pick helps normalise a simple act of litter picking. I know even with my own children, I encourage them to do a beach clean every time we go to the beach. And actually now, whenever we're out and about, especially my youngest son, he will point out rubbish here, there and everywhere. So it definitely does tune your eye into looking at the environment around you, I think. All the litter picks we complete obviously have immediate and positive environmental impact, and it increases patients' awareness of their natural environment and the importance of having healthy functioning ecosystems. And then also, as I mentioned previously, there's the health benefits because it's providing positive secondary health outcomes. Let's move on to the next slide. So patient feedback. All the patients that join this group state how much they enjoy being out and socialising, and it's one of our most popular groups on the board. It's usually at maximum capacity unless other things have hindered it, things like transport or staffing. There's just a couple of quotes there from a couple of the patients. One of them talks about how they really enjoy being out in the fresh air and off the ward, and the other one highlights this idea of actually the secondary health benefits, talking about how it helps with his lower back pain. In terms of lasting change, this project can be quite easily replicated across other service groups. It can take place pretty much anywhere and everywhere litter picking. So it's always of benefit to the environment. I mentioned how Swansea's got the Environment Centre, which provides regular litter picks, but there's lots of other organisations such as Surface and Sewage, the National Trust, who often carry out their own litter picks and will provide equipment and regular cleans. There's an increasing amount of coverage on the media around litter picks and beach cleans due to the current state of our rivers and seas. I expect some of you have seen some of the campaign that Services Against Sewage have done around this. And then following discharge from hospital, it's something that patients can still attend and access independently, either on their own or with these local groups. So in thinking about advice to others starting a group, risk assessments are obviously key, considering sort of patient restrictions, group dynamics, physical fitness, the fact that they might potentially be handling sharp objects. Obviously, we provide them with gloves, but on a ward, if you're working in mental health and potentially working with people who self-harm and things, there is those additional considerations you might need to take into account. I would always advise people to link into what's already going on out there in the communities. So as I mentioned in Wales, you've got the litter picking hubs. I suspect there's something similar in England. A lot of local councils have their own things going on. Our local community councils arranges a lot of their own litter picks. There's often local community groups, charities, and actually if you go onto local social media pages, I often find it's a really good place to start. They often advertise what's going on sort of in a community hall down the road or wherever to find out what's going on. It's a really simple activity. I wouldn't overcomplicate it. And then there's an opportunity also to link in with national campaigns, but something perhaps you didn't think you could run weekly, but wanted to do now and again. The 2 Minute Foundation have litter picking stations, and particularly if you live in a coastal area, you can campaign to request you get one in your area. We've got several stations around the coast near us in Swansea Bay. Planet Patrol also do cleans both on rivers and around coastal areas. There's a Keep Wales Tidy scheme, Surface Against Sewage, National Trust, and I expect there's many more that I haven't even commented on. In terms of spreading and scaling this project, there's loads of scope. So we were lucky enough to win the Resilient Wales category in the NHS Wales Sustainability Award 2024. And the judges concluded how it was a great, simple, effective project that's got that has both patient and environmental benefits and can be scaled up across other patient groups within the NHS. So I wrote an article about it for the OT News, and it's also went on our local intranet page, as well as in a Health Industry Leaders article. So it's all about, I don't know if any of you attended the Michael Rosen talk earlier today, but it's kind of it's that power of storytelling, letting others know what you're doing and spreading and sharing that story. As I mentioned, the project can be easily replicated across other service groups. So since we've done this project, I've met with OTs from substance misuse areas, unscheduled care, OTs working in other health boards regarding setting up their own groups. And we've also looking on the hospital site I work on an integrated hub model. So all wards across the site could potentially access certain groups like this. The homelessness service in our area have used litter picking as one of their recovery through activity sessions. And then also in terms of staff wellbeing, I often incorporate a walk and talk supervision sessions, and we might do a litter pick along the way, as well as with team wellbeing meetups. We've included that in there in our health board. So that's me talking about the litter picking group. I'm just going to got this final slide then, just to discuss some of the other stuff we've been doing within Swansea Bay in OT in terms of sustainability. So as I mentioned at the start, I did the sustainability course last year, and from that I've become a sustainability lead, and that started off with me talking to my OT service leads. I presented what sustainability in healthcare was and its relevance to OT, and discussed how we could start embedding it into our everyday practice. Following that meeting, sustainability is now a standing item in their agenda in all their business meetings. I managed to get onto the new rotational Band 5 OT induction day, and I did a presentation to them again around the sustainability in healthcare, and I've also done that in some of the OT service business meetings as well. I've recommended that all OT staff complete what our localised training is, which is called Achieving Net Zero in Wales. And I've also done a presentation to our Swansea Bay Green Group around the litter picking project. I'm currently with one of my colleagues in the process of setting up a Sustainability Champions Network for the OT service in Swansea, which is suitable for any OTs who work across Swansea Bay and looking at improving our OT practices, working more environmentally friendly way. And that's for any grade. It's not just for qualifieds, it's for all staff. And we've just actually last week signed off on an action plan with short and long-term aims for the next year of some of the things we want to do, and included in that is we're keen to do a Go Green campaign in the next few months, which look to take some quick win sustainability pledges similar to some of the ones that Jackie mentioned, and actually I think I might steal some of the ideas she had because I don't think I'd already thought of them, so that'd be great. And then also really excitingly, I've just started linking in with Swansea Uni and collaborating with them, embedding sustainability into their OT course curriculum. So I'll be interested to perhaps at some point speak more to Catherine about the planetary health report card, because I'm not that clued up on that at the moment. And that is me. So any questions from anyone? And I'll just come out of this now.
Annie, that's really fantastic. Thank you so much for sharing that. You've done so much, and it's really inspiring to hear the benefits for the patients and the environment and the staff. All the win-win situation that it is, and also how you've taken it wider is really great. So
Thank you.
I'm going to let other people ask questions first.
Yeah, Lucy.
Thanks, Andy. That was really, really interesting, really good. It's a fantastic project. It just made me think about, I heard a guy interviewed from Guernsey the other day on the radio, and he was talking about how he collects plastic, or him and his group collect plastic bottles and make art out of them. And he had a sense of a lot of the litter was not coming, it's not coming from people living on Guernsey at all. It's coming from great container ships and people illegally dumping waste in the sea. And I wondered if you had a sense of, in Swansea, where a lot of the stuff is coming from, whether you have any idea about that, whether it's people whether it's tourists, or
I think it's
and
a
what it
mix.
consists of.
Yeah, I mean the beach cleans, because I beach clean a lot. I found, I think it was last year in the storms, my son found a bit of the Lego container Lego. So it's obviously that's still washing up, even up as far as us. So there is that sort, but then I often go to the beach and I look at stuff and I'm like, God, this has clearly been dropped within the last week. There's that real juxtaposition between stuff which is ancient. I picked up one of those Smarty Lids the other day, and I think it was a Rowntree's one, and Rowntree's, God, how long ago it's been since they made the Smarties. So yeah, there's a real mix match, I think, in terms of some stuff you notice is really local. In the summer we have big issues with especially kind of younger people having big beach parties, but not thinking about actually the leaving of waste at the end of that. And that's really notable when it's above the tide line of it being new waste, whereas when the storms come in, it's a real mix. But then